Are you getting ready for your upcoming NMC OSCE exam? Do you know things to keep in mind while demonstrating assessment station in NMC OSCE? This video helps you to understand how to ask some probing questions and also explains about ABCDE assessment in NMC OSCE. In general, your adult OSCE assessment station goes in this order. First of all, you check scene safety and confirms privacy and dignity. Then you go on to introduce yourself while doing a hand rub using WHO guidelines. If it's a community scenario, you can use the sync. Then you go on to confirm the identity of patient with records. After this, you will ask some probing questions, which we will discuss later in this video. Then you will enter to a TE assessment, which includes checking observations. You will also perform neurological examination or GCS assessment if scenario given is of neurological patient. Moving ahead, you will find out what other problems do the patient have to do the appropriate referrals. Finally, you will explain and complete new score, along with escalation plan. You disposes of equipments and hand washes or hand rub with alcohol gel before you leave. That was a brief overview of the whole assessment station in adult NMC OSCE. But what we are going to discuss in this video is about the probing questions and a TE assessment. We have already done a video on neurological assessment previously, whose link is given below in the description. After safety check, introduction and patient identification, your first question should be about reason for admission. This question can be worded as, "Do you know why you here?" Here the patient will explain to you what has happened to him and why he is admitted. This will give you the first problem for your planning station. It can be a variety of reasons such as head injury, abdominal hernia, exacerbation of asthma, depression, ectopic pregnancy, falls, hemicolectomy, malnutrition extra. Second probing question is, are you comfortable? This will probe patient to give answer about your second problem for planning station. Patient may say he is in lot of pain. Then you need to do your pain assessment. Patient may say that he is depressed. Patient may be in respiratory distress extra. You can now note down that problem in the answer sheet given. The third question will help you when you are having a thought block after your TE assessment. For example, if you are missing signs like cigarettes on the table, walking aids next to bed, reading glasses on table, or even a half-finished soup. Do you have any other thing to tell me? Will help the examiner help you a bit if they wants. If you are getting answer for these questions, you can go ahead with appropriate referrals for the patient, such as smoking cessation, orthoptics, optician, dietitian, physiotherapist, occupational therapist, pain service, TVN, respiratory therapist extra. If you think there are any other probing questions which will help you in this station, please let us know by commenting below this video. Now we will move to our next section of this video, which is a TE assessment. ABCDE in NMC OSCE stands for airway, breathing, circulation, disability and exposure. In airway, you will check for any secretions or obstructions. If you don't find any, you will say, airway is clear, no obstructions. In breathing, you will check for signs of respiratory distress, such as use of accessory muscles, sweating, cyanosis, or seesaw breathing. You can confirm with patient or examiner by asking, are there any respiratory noises such as rattle, wheeze or stridor? If the patient given in scenario is a respiratory patient, you may see that patient is already coughing while talking. Then you will check the saturation of patient. Check the finger is clean, no nail varnish, no cuts and signs of inflammation, and no clubbing. Check capillary refill test before taking saturations by pressing nail for 5 seconds, then releasing. Then you will note the heat rate and saturation on news chart. Do hand hygiene after writing. In circulation assessment, you will check heart rate, respiratory rate, and blood pressure of patient. You will tell patient that you will check patient's heart rate for 2 minutes. Declare, I'll use the radial pulse to take the heart rate for 1 minute and take the respiratory rate for the other minute. After checking, say patient's respiratory rate rhythm and depth is regular, and whatever value you got. Also say heart rate rhythm and strength is regular, and whatever value you got. Document both in news chart. Hand hygiene after documenting. Moving ahead, you will ask patient or examiner, do you have any fistula, cannula, bruising or bleeding in your hand? After checking, say that patient does not have pallor and looks well perfused. Document the value you got in news chart and do hand hygiene. Next is the disability assessment. If you have got a neurological patient, you need to perform a GCS assessment here. As CVP, you can be assessed by asking, do you know where you are? Do you know what time it is? You can ask more about pain here. Ask, do you have any pain now? Score the pain. Have you received any medication? Are you happy for me to continue? In exposure assessment section, which is coming next, you will check the temperature of the patient. Confirm with the examiner or patient about any possible cuts, bruises, bleeds, rashes, or any injuries. Document value of temperature you got in your News2 chart. To conclude, assessment station is one of the easy stations in NMC OSCE if you know what you are doing. You should read the given scenario properly before starting this station. Take a deep breath before the examiner starts the timer, and be confident. Make sure you ask the probing questions, as well as complete the observations using a ABCDE assessment. During the assessment station, if you recognize you have done a mistake, say to examiner that you have done a mistake or error, and how it should have been done in an ideal situation. Make sure you write the news chart legibly. Don't forget hand hygiene part during a TE assessment. The more you practice this station, more the flow you will get in demonstration of this station. If you like this video and found it useful, please share it with your friends who are attempting NMC OSCE. You can buy our OSCE guide from Amazon by searching NMC OSCE for Overseas Nurses by Lovelin Joshi. More free materials can be found on our ever-free website, which is www.oscetrainer.com. Please like, share, comment, and subscribe this channel for updates, as well as tutorials in regard NMC OSCE. Thanks for watching.